Monday. Many of you have spent this past week with the kids for spring break. If you missed out on some family fun because of tired, heavy, achy legs, and it's just too hard to get around, our next guest says a non-invasive quick appointment can reveal whether you have vein disease. And also a quick painless procedure can have you back up walking pain-free. And those bulging veins can also go away. Joining us with how that procedure works and how far technology has come to make it easy and painless is Dr. Tony Reinke with Reinke Vein Center. Good morning.
Good morning.
The first thing I want to get out of the way is what I said is how you can make that process really quick and painless, because some people are hesitant to get help because they remember what that help used to look like. You remember what that help used to look like.
I do. 30 years ago, when I was a surgical ICU nurse, I used to recover some of the patients that had vein stripping. That was a trip to the OR, 6-week recovery time. Now it's completely different, minimally invasive. Patients are in and out of the office, back to their normal activities the same day.
Yeah, you went back to school so you could specialize in this.
Correct, I did. I went back to school twice. So I was a nurse, a PA, and now a doctor. I'm an interventional radiologist and specialize in vein disease.
All right, we'll get in detail of how that's impacted or how you can do that today. But first, when we say vein disease, it's common in men and women. Some people will say, oh, it's just a natural part of aging. I can't do anything about it.
That is completely false. You can do something about it if you have symptoms, including what you described earlier, as well as swelling, bulging veins, maybe even restless legs or cramps. You come in, I do a thorough evaluation that's done by me. So every single visit is seen by me under ultrasound guidance and local numbing and a little bit deeper numbing. We do procedures that close down stretched out veins.
Yeah, you mentioned some of those symptoms, one of them restless legs, and oftentimes you'll hear commercials for medications to address the symptoms, but when you're doing that, you're not really addressing the underlying problem.
That's correct. It's like putting a Band-Aid on something. So you are just minimizing basically just minimizing symptoms, but you're not treating an underlying issue.
Yeah, which means that the vein disease just marches on and gets worse, right?
Absolutely. So it's a slow progressive disease, and eventually it's going to catch up with you.
All right. Those new procedures, what does it look like?
So basically you come in, you get an evaluation. I'll decide if you actually need treatment. Not every patient that comes in needs procedures by me, but if you do, you come in, we get obviously approval by your insurance. So it's covered by most insurance, including Medicare and Medicaid. And then on the screen now you see me doing the procedure, which takes me probably under 10 minutes from start to finish. I do everything myself. It's done, like I mentioned earlier, with ultrasound guidance and a catheter. It's like a flexible straw that heats and seals the vein.
Yeah, and then what's the recovery time look like?
0. So there's no downtime. You're back to your normal activities that same day, including work, exercise, your normal activities of daily living.
Yeah. Is this one of those things, like many issues, the sooner you get to it, the better the results?
I mean, I'm biased, but yes, I think that's absolutely true. I'd prefer that you not wait until you have open wounds on your legs and severe swelling that's so bad that you have to upsize your shoes or you can't fit into your shoes. So, yeah.
And that's an interesting point you brought up, though, because I run into so many people who have those open wounds, those purple spots, the scaliness, the whole bit, and they'll say, yeah, well, I went to my dermatologist. Well, it's not a dermatological issue. It lies deeper than that. So it's important to get the right diagnosis and start with the right doctor in this case.
Yes, that's true. It's not uncommon for me to have patients that have been sort of mismanaged or misdiagnosed for many, many years, and then they get to the point that you just described, and that's sort of too late.
Yeah, well, they're dealing with wound care versus, again, the underlying issue.
Correct. And when they get to that point, that's exactly what I do. So it becomes a multi-specialty treatment for them at that point. It's me, wound care, sometimes vascular surgery.
Yeah. Is there any group of people more prone to vein disease than others?
So what I would tell you is this, females a little bit more than males, so it might be like 60-40, but it goes across all ethnicities. Anybody can get it. A little bit more common in African American, but I see everybody.
Yeah, yeah. And is there a genetic component?
Yes, actually. So genetics is the #1 risk factor. If you have just one parent that has vein disease, you have about a 50% chance. If you have both parents, it goes all the way up to 90%.
Dr. Reinke, you are very passionate about this, and so you approach things in a little bit different way. Starting with, you evaluate every single patient. You work with them from beginning to end, and you say, here's my cell phone number. If you need me, call me.
Yeah, this is true. I love what I do. I didn't do that many years of education and training to see less time with patients. So all patients are seen by me every visit. All procedures are done by me from start to finish. And then, like you said, every patient has my cell phone number. So should they have questions or concerns, they can always reach out to me.
Yeah, and if they need to meet with you later, if they need to meet with you on a Saturday morning, you're there.
Yes, I am here on Saturday mornings, actually. So yes, ma'am.
All right, that's a doctor who loves their job. Thank you so much for joining us this morning, because I know this is going to be relief to so many people.
You're welcome. Thank you for having me on.
All right, Reinke Vein Center has a special offer for our viewers. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that's 281-394-4446, or visit their website at ReinkeVeinCenter.com.